It's Tuesday, September 24th, and this is the Daily Medical News, where we bring you the top clinical medicine headlines and a closer look at the day's biggest story. I'm Mary Ellen Schneider.
And I'm Nick Andrews. Today, a novel risk score predicts heart failure risk and diabetes.
Spironolactone poses its own hyponatremia risk in patients with hypertension.
Which second-line therapy is the right choice in type 2 diabetes?
And why EHR interoperability remains an elusive goal.
Plus, shuttering women's health clinics may drive up cervical cancer mortality risk.
A machine learning derived risk score can identify high-risk patients with diabetes facing a heart failure risk of up to nearly 20% in the next 5 years. The risk score, dubbed WATCH-DM, has greater accuracy in predicting incident heart failure than traditional risk-based models, and it requires no specific cardiovascular biomarkers or imaging. Starting with 147 variables, investigators at Brigham and Women's Hospital and Harvard Medical School in Boston used a decision tree machine learning approach to identify predictors of heart failure. They distilled the variables down to 10 common clinical predictors. The predictors include body mass index, age, systolic blood pressure, diastolic blood pressure, fasting plasma glucose, serum creatinine, HDL cholesterol, QRS duration, prior MI, and prior coronary artery bypass grafting. The researchers presented a study of the risk score at the annual meeting of the Heart Failure Society of America. They found that the 5-year risk of heart failure was just 1% for patients with WATCH-DM scores in the lowest quintile. That rose in a graded fashion to nearly 20% in the highest quintile.
Spironolactone was almost as likely as chlorthalidone to cause hyponatremia in a review of hypertension patients, and prior hyponatremia and chlorthalidone increased the risk. Researchers at the University of Alabama, Birmingham reviewed 71 hypertension patients whose treatment regimens included one diuretic. They presented their findings at the Joint Hypertension 2019 meeting. The incidence of hyponatremia among patients taking chlorthalidone was 3%. The incidence was 2.7% among those taking spironolactone. Among 14 patients in a sub-study who discontinued chlorthalidone after developing hyponatremia, 6 of them, or 43%, subsequently developed hyponatremia on spironolactone. The findings suggest that spironolactone is more likely than generally thought to cause hyponatremia, and the researchers caution that if a patient develops hyponatremia on chlorthalidone, be careful about giving them spironolactone.
The GLP-1 receptor antagonist, Semaglutide, cut glycated hemoglobin and body weight more than the SGLT2 inhibitor, canagliflozin, in second-line treatment in patients with type 2 diabetes. The SUSTAIN-8 trial compared semaglutide and canagliflozin as add-on treatments to metformin in nearly 800 patients. Researchers from UT Southwestern Medical Center in Dallas reported the results at the annual meeting of the European Association for the Study of Diabetes. Overall changes in HbA1c levels from baseline to week 52 were minus 1.5 percentage points with semaglutide versus minus 1 percentage point with canagliflozin. Changes in body weight during the same time were minus 5 kilograms and minus 4 kilograms, respectively. Significantly more patients on semaglutide also achieved HbA1c targets at 52 weeks, compared with those on canagliflozin. The investigators say the findings support semaglutide as an alternative to canagliflozin when it's time to intensify treatment after metformin. We'll be back with more medical news after this message.
And what will it take to push interoperability of electronic health records and other health IT systems forward? A new survey by the Center for Connected Medicine finds that senior leadership at medical practices is not fully committed to this push, and the financial justification for such an effort remains a concern. The fact that interoperability continues to be an elusive target despite being a regulatory emphasis for more than a decade comes as no surprise. Dr. Robert Bart is Chief Medical Information Officer of the Health Services Division at the University of Pittsburgh Medical Center. He says interoperability certainly helps healthcare overall in the U.S., but whether it contributes directly to the financial bottom line of a specific organization might vary significantly. Dr. Bart says financial incentives won't be what gets EHRs and other health IT into more interoperable space. Instead, the Fed's push to bring ownership of health data to the individual will be a key factor. He says there's a second factor as well, and it's going to take a lot more involvement from government to achieve, establishing a clearer definition of health IT standards.
The closure of women's clinics may be driving up morbidity and mortality among patients with cervical cancer, based on a study of more than 200,000 cases. States with a declining number of women's clinics per capita between 2010 and 2013 had less screening for cervical cancer, more advanced stage of cervical cancer at presentation, and higher mortality from cervical cancer than states with no decrease in clinics. Dr. Amos Shrivastava of Washington University in St. Louis is the study's lead author. Speaking at the annual meeting of the American Society for Radiation Oncology, Dr. Shrivastava said the changes have happened within a relatively short time frame. Between 2010 and 2013, about 100 women's health clinics closed. Dr. Shrivastava says the closures were due to a combination of factors, from funding and restructuring to laws passed in many states that ultimately led to clinic closures. To determine the closure's impact, the investigators divided states into those that had women's clinic closures between 2010 and 2013 and those that didn't. They found that the screening rate among women with cervical cancer in states that had clinics close was 1.6% lower than in states that didn't close clinics. That disparity was more pronounced in specific demographic subgroups, such as among Hispanic women, young adult women, and uninsured women. Early-stage diagnosis was also significantly less common in states that had a declining number of clinics, by a margin of 13%. Finally, the overall mortality rate among women with cervical cancer was 36% higher in states with clinic closures. That disparity climbed to 40% when comparing only metro residents. Dr. Shrivastava says the findings should give physicians pause and spur them to try to address the disparities. And that's it for today's Daily Medical News. Remember, you can find us on Apple Podcasts, Google Podcasts, Spotify, and YouTube. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. Thanks for listening to the Daily Medical News.